Good afternoon, classmates. My name is Amber Edwards, and I am presenting Step 3 on behalf of Group 5, Refining the Research Question. So our original research question was, will adults with dysphagia post-stroke demonstrate greater improvements in swallowing function from neuromuscular electrical stimulation as compared to traditional dysphagia therapy techniques? Our refined action research question: will adults with dysphagia post-ischemic stroke improve functional swallowing outcomes, such as oral intake, weight gain, and quality of life, as measured by MBS and PAS after the distribution of NMES over a 6-month period? Our original research question was very vague in regards to our expected outcomes. Our original outcomes did not address how improvements in swallowing function would be measured. We did not specify the improvements we were seeking. After taking into consideration the comments from our peers and Dr. Walden, we were able to narrow and refine our action research question to include the appropriate measurements and outcomes. Our study is now evaluating the functional swallowing outcomes as measured by a modified barium swallow study and the penetration aspiration scale after the distribution of neuromuscular electrical stimulation over a 6-month period. We decided to use the PAS as our method of measurement of swallowing function. The PAS is an ordinal scale that evaluates the airway invasion. It provides a more accurate and reliable determination of severity. The MBS is a fluoroscopic procedure designed to determine the severity and to determine whether food and liquid is entering a person's lungs. In order to be eligible for this study, patients must have a PAS score of 4, in which the bolus enters the airway without clearance and it adheres to the vocal cords, but it does not pass through the vocal folds. Our goal after the distribution of the NMES is to lower the PAS score from a 4 to a score of 2. The SWAL QOL is used to measure improvement in swallowing functions. And MBS will be used to objectively measure the swallowing process pre and post NMES treatment. We have initially chose a study that mirrored a group design, such as the NMES versus the TDT. And now participants are going to act as their own control. These are some examples of the scores for the PAS. It starts with number 1, in which material does not enter the airway, to number 8, where material enters the airway and it passes below the vocal folds and no effort is made to eject. Some outcomes to consider. Dysphagia treatment with NMES will result in greater improvement over a 6-month period, as evidenced by lower scores on the PAS for post-ischemic stroke dysphagia. Functional swallowing outcomes such as oral intake, weight gain, and quality of life will improve as evidenced by higher scores on the SWAL QOL. There can also be a decreased swallowing function, so the dysphagia might worsen, or attrition of subjects, so patients might be released from the hospital or death. Here's an example of the SWAL QOL. The SLP will ask the patient some questions such as, dealing with my swallowing problem is very difficult. The patient can rate it from 1, which is very much true, to 5, not true at all. Outcomes. So establishing and maintaining relationships with patients with post-ischemic stroke NMES treatment and self-monitoring requires careful preparation and ongoing support meetings with the patient and caretakers. The results of the study will show that patient engagement and self-monitoring can have a positive effect on the development, dissemination, and implementation of dysphagia treatment in combination with patient counseling. Engaging patients in the rehabilitation process by validating their own perception as important clinical information enables mutual learning and enhances the quality of health research. The project team which includes the SLP, patient, physician, and family, will report whether or not a positive impact is observed. The aim of the study is to see if the NMES treatment and patient self-monitoring and self-perception of swallowing will improve functional swallow as reported by objective measures, which are the PAS and MBS. The results will promote development and implementation of health research in terms of a patient-centered therapy approach. The action research process will also have a positive effect on the SLP patient encounter. The patients who participate will benefit the most since they will be able to identify the swallowing function and its components and will be able to collaborate in making informed decisions about their own treatment. The SLP will keep a reflective diary in which they will record what happens during the meetings with the patient, physician, and family members.